Lachman from Cool Dental. There are different types of gum infections. The most common is something called gingivitis. You hear about it on TV all the time. Gingivitis is basically swelling in the gums. There's no damage to the bone around the teeth, but there is swelling, puffiness, sometimes bleeding in the gums. It may or may not hurt, but basically if you're flossing and there's blood, it doesn't mean you're flossing wrong. It means you probably have gingivitis. You probably have inflammation or swelling in the gums. That can be treated. If the swelling or the infection spreads from the gum into the bone starts to shrink away. You may not feel any pain. When the bone is shrinking away, now you have what's called periodontal disease. That is one of the most severe kinds of gum infections there are. There's early, moderate, severe, there's all kinds of different types. What you need to focus on is that the bone loss is often painless. You don't walk around with pain in your bone saying, oh my God, my bone is disappearing. No, the bone just slowly shrinks away, and then one day the tooth starts to loosen. You come in and say, Doc, my teeth are loose. And I say, well, I'm sorry, Mrs. Smith, we have to remove your teeth. Why? My mom lost her teeth. Am I losing my teeth because my mom lost her teeth? No, your mom probably had gum disease, didn't know it. You have gum disease and didn't know it, and that's why you're losing your teeth. You don't have to lose your teeth, but you have to be diagnosed with what type of gum disease you have, okay? How do we diagnose it? We have to physically measure. And if you're not keeping track of those measurements every time you come in, your gum disease may be getting worse and you don't even know it. So that's why here at Cool Dental, every time you're coming in for a cleaning, we are measuring your gums. And we show you the measurements and we explain the measurements. There's a computer screen right in front of you and you'll see red numbers are not good. Red numbers mean there's inflammation, there's damage. Green numbers mean things are getting better. Black numbers mean things are stable. So it becomes a very intuitive way for you to keep track of your own health. We want patients involved in their health care. Dentistry is not rocket science. Dentistry is dentistry. Once we teach you the basics of dentistry, you can be well versed and knowledgeable in your own dental health care. Thanks.